Welcome back to Dr. Sellers Educate as we continue to support you on your journey towards success to achieve your certification as a nurse educator by the NLN. We are thrilled that you're here, and go ahead and subscribe to this channel if you haven't already. Every single week, we release new content right here on our YouTube channel to better help you focus on some of those key concepts to help you be successful. For this specific episode, we're focusing on competency 6 as it relates to the importance of us as nurse educators taking on the responsibilities as a leader, both informally and formally, to help support change that needs to happen in our nursing education system. So we're going to focus on some of those key concepts, and we're also going to look at a practice question. There are several definitions of the manager versus the leader role as it relates to responsibilities in the nurse educator role. We are going to be referring to the resources that have been recommended by NLN as we hone in on content that will help you be successful in answering the questions that will show up on the exam. The manager role is often associated with the title and task in the role. Okay, so we're going to focus on the comparison between the two and really help you discern when questions come up on the exam, how you can differentiate exactly which choices you might want to choose on the exam. The leader, this can be any individual. It's not associated with a specific title. These individuals are often visionaries, and they gain power through influence and trust in relationships. The manager, this is often a title that is given to someone or an assigned role that identifies a specific area of responsibilities that they are expected to complete. This is a more formal role in the sense that there are specific guidelines and deliverables that this individual is expected to reinforce related to processes in order to meet their goals. There is often a limit to new initiatives to get the work done because, again, the focus is ensuring that the specified expectations are accomplished in a set period of time. Now, when we think about the role of the nurse educator, there are a variety of leadership skills that will help us better understand some of the business aspects of healthcare. One key component is looking at understanding the clinical practices and how they align with the work that we want to do with our students in the healthcare setting. So let's take a look at this practice question. Nurse educators are able to role model leadership practices in their student relationships to support cultural sensitivity when advocating for change. So which of these actions would be the most effective in helping to role model interdisciplinary efforts to address healthcare and educational needs? If you want to pause the video and come back when you're ready, we'll talk about the answer as well as the rationale. If you chose C, participating in patient rounds with students to address patient needs, you are correct. So congratulations. This choice is going to best help demonstrate interprofessional collaboration to meet our patients' needs, remembering that is the focus. We also know that leaders do emerge from the group, and depending on the circumstances and the needs of the specific assignment, there may be informal leaders that step up, that raise their hand to help support achieving the goal of the group. There are numerous opportunities for nurse educators to take on more of a formal leadership role as well as informal. As we see more universities move in different directions for their curriculum to better meet the specific needs and associate with the trends in their community, specifically their healthcare community, there are opportunities, more and more opportunities for us to step up and take responsibility for ensuring that we are providing a rich learning experience for our students and developing a solid curriculum that's going to align with our program outcomes and delivering key components of education to better equip the nursing students with the knowledge they need to perform at the highest level upon graduation. This concludes our snapshot for this session. This has been Dr. Sellers Educate. And again, this episode focused on 3 key components. As we wrap up our session and our time together for this episode, we want to remember 3 essential elements as it relates to being a change agent and a leader in our role as a nurse educator. First, understanding the differences between the role of the formal manager versus the informal leader. Second of all, understanding what our opportunities are as we engage in our students' learning experiences to support and role model some of those behaviors that we want them to emulate as a leader. And then third, being a change agent to make adjustments to the curriculum to ensure students are receiving a rich learning experience that is going to achieve the highest level of clinical performance when they transition into practicing as an independent clinician. We do that in a number of ways, but we want to make sure that our curriculum and ultimately our program outcomes are met. Thank you for joining Dr. Sellers Educate. Feel free to reach out to us if you have other questions, and we'll see you next time.